high blood pressure and high cholesterol, because these conditions will cause changes in the eye that your optometrist can see when they use high-powered equipment.
Dr. Diva Chaudhry is here. She's an optometrist. So how is it possible that just looking through the eye without any extravagant equipment can help you identify blood pressure, the effects of blood pressure, not even the blood pressure itself, but the effects in your body of blood pressure and of cholesterol?
Absolutely. There's a lot of narrowing and hardening of the blood vessels. These are the same blood vessels that travel to the back of your eye, to the retina. So as an optometrist, we'll actually see severe cases where there's bleeding and hemorrhaging in the back of the eye as well. And if
okay, so there's the picture one, just to point this out. You see the little blood vessels, everybody? You see where the little bruises? Now that is actually a bleed that happened in the eye of someone who had high blood pressure. I'm sorry, Diva, go ahead.
Yeah, and if you leave this untreated, it can actually cause severe vision loss and, of course, a heart attack or stroke. And this is very common for optometrists to pick up. We actually had a patient that came into our office for a routine eye exam, took a look at her retina, and we found that there was bleeding in the entire retina. We called the ambulance, they picked her up. The doctor had called us from the hospital and told us that she was about to have a stroke.
Yeah.
So we didn't just save her vision, but her life as well.
Remember, it's the one place we can see inside the body.
Absolutely. From
the outside of the body. Right? You can't see the heart without causing a lot of damage.
Exactly.
But you can see the back of the eye, which is, again, attached to your brain and shows all those blood vessels. And high cholesterol, what does that look like?
High cholesterol, we see it all the time. Probably about 65% of the time, your optometrist will pick it up before your other doctors will. And with high cholesterol, we can see the yellow plaques embedded in the artery.
You see them right there with the arrows pointing to it? Now, if it's in your eye blood vessels, guess where else it is? It's in your heart, in your brain vessels, kidneys, all the other ones, but we can actually see them in the back of the eye.
Yeah, absolutely.
Good work. Coming up, find out how